is your video for training. What are you going to call it?
IV training therapy.
So I like to have it at kind of where it would look like when you start. So when you're not using the IV, you can just tuck it away like this. Just having this pad under here can just be more comfortable to have these plastic pieces away from your skin. And then, so it's two parts, like the soft one goes first and then the tighter one goes on just to hold it all together. And then these are just extra that I will put, there was a bag, oh this one, with the shower sleeves in it, these blue ones that you can just pull on top of this cotton sleeve. To keep it dry for showers.
Nice.
These little hooks we provide to in place of a IV pole. Like you can stick one of these on your wall about as high as you can reach to make sure that there's enough gravity to let the drops fall. So there's a couple there. And then when we go to do the dose, it says wipe off your table. We want it to be just, no, you can, I know them. You can have it back towards you or whoever. Wipe off your table. We just, want to get like toast crumbs, like just physical things off the table. I have wiped this one already. And then we always want it to be just like a hard surface. You don't want to have like, people think, oh, I'll put a tea towel or the bed or something. No, it needs to be a hard surface so that no little fuzzies or anything are going to stick to our equipment. So then what it says there is gather your supplies. So I just give you a little shopping list there. So out of your, bag of supplies, you'll grab 3 of the saline flushes, 4 alcohol swabs. They come in little 2-packs, so we'll just grab 2 little packs. The IV tubing. Let's go to our next bag. Package of the tubing and a dose. The IV medication bag, like this.
Yeah, I'm not sure how many days we're going to be down on the coast for. Can we make those other ones that you have into the bags as well?
I would like to, talk about our plan there.
Okay.
Just so we can make it clear for the pharmacy,
Okay. Depends how he's feeling, right?
Mm-hmm.
That's the promise of that.
Yep. And then that's to go as well. All right. So then you've got your equipment out. So now it says open the packages and prime the flushes. So we need to open all these plastic wrappers and get rid of them. So I say just make yourself a garbage, or if you have a garbage nearby, just so you can keep your area clear. To prime the flush, we'll just open the lid slightly and then push up till you get a dropout. If you hold it upright, the air goes to the top.
Okay.
And then tighten the lid back down to keep that tip protected, because that's what can't touch anything. It has to stay sterile.
Okay.
Is this tip here.
Okay.
So that's what we're careful of. And then whoever would like to participate, please copy what I've done.
And just do what you just did.
Mm-hmm.
Okay.
Oh.
So that's what happens when you take the lid off. And now you've contaminated the lid, so we won't use that.
Oh no.
Let's try that again. So this as long as you don't touch that tip, it's okay. You can put it down on the table carefully.
Okay.
So
Just
that
don't
it-
use the lid.
I wouldn't if you've touched it with your
Okay,
hands.
okay, great.
It's dirty. Let's actually go back to our book where we talk about, we kind of skipped the first part, which was talking about the no-touch technique. Most important part of doing IV therapy is ensuring that the equipment that connects to his IV is sterile. The end of his IV has to be sterile when we connect to it, and we do that by cleaning it with is it okay if I take this down? This part of his IV has to be sterile.
Yeah.
So we make it sterile by cleaning it with an alcohol swab. Once we've done that, you can't put it down, you can't touch it. If it gets touched by anything, you have to start over and clean it again.
Okay.
You can always re-clean his IV.
Okay.
So say, we've got our syringe and we're trying to connect it, but it slips and we bump and touch. We have to stop because that's one rule we can't break when it comes to doing IV medicine.
Yeah.
You cannot touch these sterile
without
ends.
being sterile.
Exactly. You know what, like our hands aren't sterile.
No.
This part's not sterile. The tip is what matters because
Yeah.
that's what's connecting
Yeah.
here. Same with this tip. We can touch it down here, just not at the top, right? So we can always put his IV down, but if we contaminate this syringe,
So it's contaminated now.
it is, yeah. I'm just explaining if,
So how do I keep that from getting contaminated? Like just, because I noticed, would I clean it and then just put it back there, how you had it, until I've done this?
no, we are gonna clean it right before we connect to it, so we
Okay.
know it's
So
sterile.
no matter what?
No matter what, we're always cleaning
Okay,
it before we connect anything to it.
Okay.
What I'm saying is if we contaminate the supplies and we need to get another one out of the box,
Mm-hmm.
you can always put his IV down. You can say, I'm gonna clean this again. So that's fine, just put it down. Make sure what you're using is sterile.
Okay.
Yeah. And I'll show you how to do that.
But it's fine right now because I never touched it.
That's right.
Okay.
That's just the principle that you have to keep in mind is, have I touched the tips and have I wiped this
Okay.
before I connected
Okay.
something to it? If you keep that in mind, you're gonna be fine.
Okay.
That's really the only way you can hurt yourself doing IV stuff is touching these tips or giving the medicine too fast, which in his case, his medicine is very forgiving. It can be given faster than we're gonna do right now. So that one we can kind of forget about, but it's that cleanliness of the tips is not negotiable. Yeah.
Okay. I'm just gonna wash my hands again.
Please, yeah.
We'll have to take that sink home.
Yeah, forget one. Yeah, under there. So when we open the instructions up at the how, it actually starts us at this page because this is what I would say one of the most important steps of the whole thing is getting our medicine into the bag. This is just saline in the bag here. Here's the medicine. So I drew up these instructions to show you that it's just water at the top and the medicine's in the bottom. So then once we mix it, we'll pull that medicine into the liquid. So the first thing, this is step number one.
So step number one would be to hang it first, right?
No.
No? Okay.
Step number one is, like, you'll see them breaking this little seal right
Okay.
here. So that, because right now the liquid can't go into,
Oh, so you break the seal and
Yep.
the liquid goes through. Okay. Oh my gosh.
yeah. There you
There
go.
we go. And then squeeze.
Yeah, and make sure it goes both ways so that it can go through easily. Good. Yep. And then squeeze that liquid into the powder.
Ooh,
Why are we dripping? That's weird. Get the faulty one. I don't know why that did that.
I heard the seal break too.
yeah, the seal has to break.
And you always have to release it, like till, because this is a closed system, we have to allow some air to go in there if we're gonna squeeze. There we go. See?
You're trying to put it into the bottle or it's coming up?
We're trying to put it into the bottle.
Okay.
And once we see the liquid come up past this label,
Yeah.
like we're gonna keep squeezing, keep squeezing, keep squeezing.
Okay.
And then we have to shake, 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 shake.
And that's it. Shake everything. Okay.
So in this jar,
Mhm.
we don't wanna see any chunks.
Too bad. We'll have to clean that too, right?
So let's
Okay.
peek into the jar.
Seems good.
I don't see any chunks, that looks good. So then, always follow the book.
Mhm.
The book is telling us now to flip it upside down so that the jar is on top. And we're gonna squeeze the bag again, squeeze and release, the same way that we got
Milk the cow.
milk the cow. Squeeze and release, milk the cow, squeeze and release. And you see that liquid coming into the bag.
Mhm.
Is the jar empty?
Pretty much. Oh, one more. Yeah, pretty much empty.
Good. Then I just give the bag a little shake just to mix it all up. And that's ready to go.
Okay.
Good. We could just put that down. We'll flip to the next page. So we're gonna keep preparing our supplies here. So we'll be careful with that tip. If we touch it,
Yeah.
we grab a new one.
Toast.
Mm-hmm. So let's get them all the flushes ready.
Okay.
Mhm.
Can I put this on there?
Yep. The lid?
Yeah.
No.
Okay.
So like I was showing you, where you just loosen it and then squeeze up. Just loosen it enough so that the air can come through. I would get rid of this package just so it's out of the way.
Okay, now I know the air's out because
Mm-hmm.
it's dripping.
Exactly. So then
And then
tighten.
just screwing it.
Yep. Tighten the lid to protect it. Good. Now you can put it back down on the table. And then It says prime the flushes and arrange them in order. 3 saline syringes, alcohol swabs. Only open 2 alcohol swabs because they dry out. So we're gonna flush his IV once before the medicine and twice after. So what I like to do is take your other 2 alcohol swabs and just put them over to the side because you don't need that till after. So the alcohol swab, if you rip it right down the middle, it pops it out for you.
Okay.
Yeah. I like to put them in the order you need them. So you're gonna wash his IV, flush it, wash it again, and then connect the medicine.
Okay.
So our next step is remove all the packaging. So prime the tubing, remove all the packaging from the tubing.
Okay.
So the side with the 10 on it has a perforation there, so it just opens like a bag of chips.
Like that?
Yep.
Okay.
Mm-hmm.
Now just take it out.
Get rid of the packaging. And get rid of the paper. Just rip it. Good. And then I'll show you all the pieces of the tubing. Okay, so the top, under this cap here, there is a spike. I kind of remind you here about the top is the spike, the bottom is the drip chamber. This is the part that will fill up with fluid after we connect the bag. Other pieces of the tubing to note are going to be this clamp doesn't do anything.
Okay.
We're not going to use it. This is the roller clamp. This is how we control how fast the liquid is coming out of the bag. So when it comes, it's open. So what we have to do is close it all the way shut so that when we attach the bag, it's not going to come spilling out everywhere. That's all.
Okay.
And when we're holding the tubing, we want to make sure that it's not like flopping on the floor or anything. We've just kind of got a handle on both the ends. Perfect.
Make it go right to the end, right?
Yeah, all the way tight. That's good.
Okay.
So that's how the the instructions are guiding us. Remove all the packaging and close the blue roller clamp. Pull the blue tab off the medication bag and keep the end from touching anything. So let's get this out of the way because we don't need it right now. So these ends have caps on them, so we don't have to be so worried about them touching anything. You can put it down.
Okay.
So here's our medication bag. So the blue,
So which one do I attach this, or just take this off?
take this off.
Take that off. Okay. Don't touch.
It just pulls. What you need to not touch is what's underneath the cap. It's protecting what needs to stay clean.
Oh,
Yeah, it's
how
like-
do you guys get this?
You just,
Oh.
it's all good. It's like rubber band material. It just rip. And then we're gonna connect the top of our tubing.
So do I clean this first, or just I haven't touched anything?
It's easy to remember because none of the equipment can be cleaned.
Okay.
If it gets bumped, you have to grab a fresh one.
Okay. So
Yeah. So that's just exactly what you're doing. You hold it in the air. Good.
okay.
So now I say just keep everything straight. You can make it all flat there. You're gonna hold it on the squishy part there.
Okay.
Perfect.
And then just put it in.
Push and twist. So it's the twisting motion that matters here, and push and twist. You got it. You're doing perfect. Good.
Okay.
Yeah, once it's up to that fat part, you know what I'm trying to say. Get it up to that little indent. Yep, you got it. That's perfect.
Okay.
Then at this point, we will hang it up on our little hook.
Okay.
I'll be your hook, just for now, because your next instruction is important. Remove the cap from the IV tubing spike. You did that. Push the spike into the medication bag using a twisting motion. Hang the IV bag at least 3 feet above your IV, like his arm. Squeeze the drip chamber until it is half full of fluid. This is a commonly forgotten step and very important. You don't have to squeeze the bag, you squeeze the drip chamber. Push and release, till it's about half full. That looks good. bit more, that's okay. Let's get our tubing in our hands now. Good. So now it says, slowly open the roller clamp. We're gonna follow this fluid level right here with our eyes. Okay? And you'll just, little motions on the roller clamp make a big difference. So we're gonna slowly make little adjustments to opening that. Here it goes.
Not even moving it.
Yeah, just keep an eye on it. Keep an eye on your fluid level.
Where did it go?
It always wants to be opened up a little bit. Oh, here it is.
Okay.
It'll always slow down right at the roller clamp there.
Okay.
Good.
I'll just leave it.
No, we should close that off. This is a cap that will only allow air to come out.
Okay. But I think it's not quite up. Yeah, it must be.
It must be.
Okay.
So then, very important step here I've highlighted for you is to close that roller clamp, because we have to take this cap off to connect it to him. And if we're all the way open,
Okay, so close it.
when we take that cap off, it'll just come full speed
Oh, you'll know.
all over the floor. That's not where it's gonna help.
Okay. So you open it and then you close it. Okay.
Yeah, because we gotta get that air out of
Yeah.
there. So we're fluid all the way through. Perfect.
Okay.
So that's called priming the tubing.
Okay.
Okay. Then we just want this, we could even hand to him and say, here, can you hold that, please? Perfect. So now we're on the second page of the instructions. Mindful of our open tip there. That's why I like to leave the caps on, just so you know they're not going to be big. So now it's going to guide us. Swab the end of your IV with an alcohol swab for 15 seconds. So to do that, we hold his IV at the fattest part there, and there's little grips for your fingers.
Okay.
We put it on top like a hat, and then it's a 15-second clean. So I do that like twist back and forth, like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Little scrub on top, just because that's where it opens. Feels good to wash it down. And then we will grab our saline syringe, and we will just see that middle part is just going to fit right inside. So we push and twist. His IV has clamps, so we have to open those, obviously, to get the liquid through. So there's 2 clamps. There's one there, and then there's one here. If you pull that bottom part down, that opens.
Okay.
Okay? So then we're going to use what's called a push-pause technique. So I say just push with your thumb for 1 second, and it just looks like lots of little pushes. He shouldn't feel anything.
Then maybe cold.
Maybe cold, but probably nothing.
Yeah.
Then we're going to put our hands back on the grips, disconnect, garbage pile.
Okay.
And then you just reach for your next saline, which will clean, and then connect the tubing.
Okay.
Okay? So we'll
Can we
just,
clean it right now?
what I'm going to do is switchy spots actually. put it back the way it was and reset your equipment so that if you wanna. So leave it double layer
Okay,
so that it's got enough alcohol to do its job.
so do 15 seconds first.
You got it.
And hold it where the grip is. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. I didn't move so much. 12, 13, 14, 15, 16, 17. Well, that's good enough, right?
Yeah, 15's enough.
Okay. And then I will open this one first, this clown.
Yeah, we can even do that before, or let's,
And then open this one.
yeah, you pull it down from the bottom there. We can also connect.
Sorry, Shadow. How do you pull it?
Let's connect our syringe just so our sterile ends are covered, and then we can use both hands to do the clamps. Hold it right on the fat part there so you have control. There you go. Perfect. You can even hold it way higher up on the syringe. Not
Okay.
that part, the syringe.
Oh, that's
Yeah. Perfect. Twist.
okay.
You got it.
And ask him to hold it.
Or you can just put it down on the table there, yep.
Okay.
And then use both your hands to get that bottom part of the clamp down. I'll show you where it opens. This little part is clipped into here, so you pull it down to release it.
Pull this down.
So it's open now.
Okay.
I just want you to see what happened there.
Yeah.
And then we push it so that it clicks in
Okay. And
to
then.
that bottom part. And then,
So is it? It's
there. Now it's open.
Okay, I get it.
Yeah.
And then just flush slowly. You said do 1 second.
This is like the turbulent flush, so quick pumps. Quick pumps. Yeah. That's right. Good. That's a flush.
Okay. And do I take this off and then close it?
You don't need to close any of the clamps till we're putting it away.
Okay.
We'll leave them open this whole time.
Oh. There we go. And then
Yeah, you can always just put it down because we're gonna wash it again.
okay.
This was your one that you had ready for the next part, because when you think, okay, now we need to get him his medicine, we gotta connect the tubing.
Okay.
So we always have to wash it before we connect something to it.
So I need a new one.
So how do we had this
Oh,
one
we have
already.
This one. Okay.
Yeah, we opened 2 and we
Oh,
we
okay.
left 2.
Okay.
And the instructions do guide you to open 2 and leave 2. Yeah, good.
And these are all garbage.
Yeah, this is all garbage. This is like your little garbage pile.
Okay. And then I gotta do another. Where's the instruction?
No, it said swab the end of your IV. Flush it with the first saline syringe. Swab the end of your IV. So you just did that. Remove the cap from the end of the tubing. So he's holding the tubing on his lap there.
Okay. Now I
Remove the cap from the end of the tubing.
put this cap.
You got it. Just twist and pull, kind
Okay.
of. And we connect it just like the syringes. Good. Open the roller clamp to start medication and infuse at the rate indicated on our page. So this is our county drops section. You know what? Here's a cheat. About halfway is usually about right.
Okay.
So if we just aim for half open,
Just slowly.
you don't have to do this part slowly. You can just open it to halfway.
Okay.
Yeah, we'll take a look at that.
Not timing it though, thanks.
Just a sec. I'll tell you. So stop counting and I'll tell you when to start. Okay, go.
1, 2, 3, 4, 5, 6, 7, 8, 9. So it should be good. 10,
We're at 10 there.
12, 13, 14, 15, 16, 17, 18, 19, 20, 21.
So we're at about 11 drops right now, which, yes, is a little fast, but
It's fine.
like I said,
You can go anywhere with something. Okay.
it's okay. So this will give his medicine over less than 30 minutes, like
Yeah.
probably 25 minutes or so. But like I said, 5 minutes is safe. So I honestly wouldn't fuss too much with getting the speed right. I would probably open it up to half and count it to make sure it's not
And you count it for a minute? Or,
15 seconds.
oh, just 15 seconds? Okay. let me just
Yeah.
try it again.
So that was how that's where our 8 is coming from. Yeah, go on.
Yeah, 11.
Yeah, 11. So we're here and my instructions are,
Okay, perfect. Okay. Thank you for showing me this. This gives my brother a little bit of freedom. Not tied down.
Yep, no, we do this often, like show people how to do it. Yeah, so then you just wait till the bag's empty. And so this is his real dose today.
Yeah.
Is today looking like home day?
Possibly.
How are you feeling?
I don't know, just remember on
Okay. Want to make sure you're feeling well enough to be home.
Yeah.
Yeah.
Pressure. None. 0.
Your blood work this morning looked good. Yeah, quite reassuring actually. Like as far as like a liver pancreas function, your blood work looked really good.
That's awesome.
Everything was either normal or going in the